Okay, so let's get into today's topic. I have never presented on this topic before, but I think it's important, and I'll tell you why. Each and every day, we talk to families. In fact, I'm going to be meeting with 3 different families this afternoon. Being in the real estate business and the business of helping people downsize in particular, our conversations are usually centered around the issues of where the best place is to move to, how to make the whole process happen, how to make it easier. And for the most part, our clients are people just like you. They are capable, able-bodied, intelligent people making the decisions on their own, as it typically should be, if possible. Sometimes family members are involved. And when family members are involved, well, a whole new dynamic is introduced, as you may well imagine. So hence today's topic, the truth about communicating with your adult children. And we are going to address if you are an orphan, maybe you don't have children. So what do we do in that case, right? So let me share with you the types of families that we engage with, and then we're going to ask these lovely ladies to dig deeper into these different types. But the types of families that we engage with are 7 different types. The uninvolved, and by the way, kind of be thinking in your own minds, which type of family do we have? There's the uninvolved. We have the supportive and available if necessary. We have supportive and actively involved, controlling and unavailable, controlling and actively involved, proxy decision makers by design, and proxy decision makers by default. So the best families to work with, in our opinion, are the ones that are well-adjusted and are the supportive types, of course. The proxy decision makers by design, those with clear instructions about what their parent or parents want and desire and don't want, are also easy to work with. It's when we see the controlling types, and you know what I'm talking about here. The controlling types, we cringe a little bit because we know it's not only going to be a long road for us, possibly, but also for the person that we're supporting and helping and advocating for. So in your kids' defense, sometimes control is just a result of them feeling responsible. They're feeling a sense of obligation. Remember, they have conflicting goals than you may have. And sometimes that's because there's an absence of information. You've never had these discussions with them before. It's maybe not comfortable. Maybe it hasn't come up. These relationships, they're just simply human nature. We're just all doing our best, I believe. But there are also other issues involved that involve more challenges. There may be codependency, narcissism. Some families have been dealing with dysfunctional communication styles for a lifetime. And so in that case, today's presentation might seem a little bit oversimplified. But that's not my intent. You need to know that there are some families that have deeper issues that go beyond what we're going to be talking about today. I'm not a counselor or a mental health professional, although we have those people here today. We're just going to address some truths that we know to be truth and fact. We're going to give you some strategies to improve communication within your own family. And then it's going to be your job. I love giving you homework. So it's going to be your job to go back and assess your situation and implement what you deem best for you. Okay? So remember, you're the expert. This is going to be all up to you. So let's dig in, and I'm just going to start by having my wonderful panelists, and we're very lucky to have these 4 women here today. We're going to ask them to each introduce themselves. So Ann, why don't you go first? Tell us who you are and what you do, and a little bit about how long you've been doing it.
Well, good morning. I'm Ann Rosenthal. I'm Ann with an E, by the way. I've added that to. our sign. I have been providing care management services for over 35 years, all of my professional life, and I thoroughly enjoy it. I have a PhD in health administration, and I am also a state licensed marriage family counselor. So I have combined my clinical skills with my training so that I have been able to provide advocacy for people, medical navigation, planning, resources, and consultations generally to either adult children of aging parents or aging folks themselves. And I'm now entering myself and thinking about many times the same things that my clients are thinking about in terms of planning.
Nice. Well, thank you. And thank you for being here.
Good morning. Thank you for coming out in the rain. My name is Margot Nagisere, and my company is Montclair Elder Services, and I'm a private geriatric care manager. My background is different than Ann's. I have a master's in gerontology, and I am a licensed nursing home administrator. So I started in that industry for 15 years. I was there, and then I ran home care, and then I've moved into being a private care manager, and I service the 580-680 corridor. And my specialty is complex medical care and support around dementia and Parkinson's care. So nice to be here, and I look forward to meeting you guys after the talk.
Nice. Thank you. Thank you. All right, Judy.
My name is Judy Warehouse. I have a much different background. I was at Kaiser Permanente for 20 years, just working in mental health, seeing mostly chronic patients with mental illness. And then when I retired in 2016, I had my mother, my father, my father, my husband, and my brother all pass within a couple years. So I had my hands full doing all the caregiving. And after I said, I'm going to specialize in this field, so that I just took a lot of classes and taught myself everything I could about death and dying and caregiving and grief. So now I just retired again from Kaiser. I have a very small private practice where I specialize in helping caregivers advocate for their loved ones, working with people that have grief issues, and things like that. And I work out of my home in Lafayette.
Wonderful. And Grace.
Okay, good morning. My name is Grace Liu. I'm a licensed clinical social worker, and Dayna mentioned Rossmore earlier. I am a full-time therapist at Rossmore, and short-term therapy is one of the perks if you live at Rossmore. So, and before joining Rossmore, just a year ago, I worked for 10 years at the Alzheimer's Association. I was the site director of their East Bay office in Lafayette. It's not there anymore, unfortunately. I also have a small private practice focusing on grief and loss, caregiver stress and burnout, and I also run an online dementia caregiver support group. I'll have some flyers on that outside after the presentation.
Lovely, lovely. Well, you can see that this panel has a depth and breadth of knowledge on this topic today. So in my introduction, I mentioned that there's a diverse group of families that we engage in my real estate practice. And I wanted to ask Judy to start with, what are some of the issues that come up with the different family types that we could discuss?
Well, of course, as you know, there are many issues that come up. And what you hear people talk about are things such as fairness, or who's going to be the primary helper. Is it the person that lives the closest, or is it the oldest? Is it the one who is the closest to the family? We also have blended families. What happens when we have step parents as well as birth parents? So one of my clients, she is a caregiver for both her stepmother and her mother, which causes her a lot of stress, but it keeps her very, very busy. Then there are families where you have one of the siblings or one of the children who maybe hasn't contributed as much as the others, and so then there's resentments, and people get upset about all that. Then blended families, I think I mentioned, but I wanted to tell you real quickly my story about a blended family. My parents divorced, my father remarried. He moved to Las Vegas and with his wife and became very close with her family. My brother, I have two siblings. My siblings didn't really like her very much, so they decided they didn't really want much to do with the caregiving. I did all of it. I flew to Las Vegas a lot. So when my father passed, of course, he left everything to his then wife, and she passed actually a couple months later, and she left things to me and her children. Well, you can imagine what this caused with my siblings. They were very upset about fairness, right? So I decided it wasn't a great deal of money or assets, but I made the decision at that time to just split mine 3 ways, because I felt like living here on this earth, I was going to have relationships with my siblings for the rest of my life, and that's what I chose to do. But these are some of the issues that come up. There are many of them, and of course I'm telling you from a therapist point of view. They're not necessarily the practical ones of just who's going to take care of somebody, who's going to do this, but as you know, they come up, and so they're things to think about.
Awesome. Anybody want to add to that? No? Okay. So, Grace, we talked when we were, we get together and kind of go over what we're going to talk about at these presentations. And we started talking about who's responsible to have effective communication. So when you're thinking of speaking with your adult children, well, who's responsible for making that an effective time? Is it the communicator or the receiver? And then I wanted to ask Grace, what are some different communication methods and maybe which are the best? So take it away.
All right. So, in my opinion, communication is a two-way street, right? You can talk, but it's also the responsibility of the other person to listen, and vice versa. So, the other person that you're talking to will probably have feedback, and then it's your responsibility to listen. So, communication is like a dance. It takes two to tango, and sometimes we or the other person might, families we all have our own dynamic and long-standing dynamics. Maybe it's avoidance. Maybe somebody shuts down or, cuts or tries to talk over the other person. So in my practice, I work with families and with couples, and one of the methods I use is something called nonviolent communication. How many people have heard of that? One person, okay. So we don't mean physical violence, obviously. We mean, because words can often hurt. So this method was developed by a gentleman named Marshall Rosenberg in the 70s. And it's been used internationally, worldwide, in everything from couples to international diplomacy. And so I advise you to check out his book, Nonviolent Communication, Marshall Rosenberg. It's really effective. In terms of the different communication methods, unfortunately these days, too many people tend to use text as their main mode of communication. And to me, text is like a Rorschach test. Those ink blots where you can read anything you want into it, right? A text is just words, and it's usually short. What's missing is that the nonverbal communication. Nonverbal communication is your body language, tone of voice, and body language, eye contact or lack thereof. So when adult children, and many of them, this is their preferred mode of communication these days, text, you're left kind of reading into their words. How are they feeling? Are they frustrated with me? Are they excited? Do they want to see me? So there's a lot of interpretation that we are projecting onto these few words. So if you're going to have an important conversation, I really advise asking for a face-to-face conversation, right? At a time that's good for both of you. Next best is phone, because at least you can hear the tone of voice. And then next best is email, and finally text.
Well, and what about Zoom? I'm thinking of, like, I met a family and the clients wanted me to meet their kids. Well, they had 9 kids. And all the kids were married. And all the kids were all around, not just the United States, but the world. And so to physically get us all together was nearly impossible. It probably would have been impossible. So we did the next best thing, which was we Zoomed.
Zoom these days is a good option, though for many people that technology is still daunting. I actually provide, in my private practice, I provide therapy via Zoom. And I found that, yeah, it's good, but not as good as if the person is sitting in the room with me.
I agree.
Obviously.
Yeah. Perfect. And I think, the lack of intentional direct communication results in assumptions and miscommunications. I mean, that's really what I wanted to point out and have any of you speak to. That the fact that you've never had conversations with your children and they're making assumptions that they know what you would want if for some reason you were unable to make decisions for yourself. You're assuming that they know what you would want if for some reason you couldn't make decisions for themselves. And I've shared with you before, there was a university study, I can't recall which university did it. There was a university study that asked the adult children between 45 and 60 years old if they knew the desires of their parents as their parents aged. And 80% of them said yes, they did. Then they asked the parents, and 80% of that 75% were wrong. And really, what that survey didn't go on to tell me was, had any of those people had those conversations? I would guess they had not, because they're all just sort of guessing. And that can be disastrous, really, because I want you all to be making decisions that are right for you, because this is your life. And that's sort of why we're here talking about this. I do talks for the adult children of aging parents, and I want them to know that it is their parents' desires that come first. It's not their agenda, it's their parents' agenda. So that's a 5-part series I do just for the adult children. But today it's about you, because you are the big enchilada in this conversation, if you will. So Anne, how do we set the stage to have this positive interaction and communication and conversation with our adult children? What do we need to be thinking about?
Yes, I love this question because Dayna has really flipped it. We're usually thinking about talking to our aging parents, and now you're in the driver's seat. This is what we're talking about. So to set the stage, to set the tone for this important conversation that you're going to have, that might take place at more than just one single time, I'd like you to imagine how that conversation is going to go. Envision it. And see yourself as the way that your ideal self can be. So you are calm, you have planned ahead, you have thought this through, and you are prepared to have this important conversation. Where will it take place? That's very important. We don't recommend you have that over Thanksgiving dinner with a multi-generational guest list. So this is something that you've planned ahead, and most ideally, the decision makers that you trust are the ones only in this important conversation. How will you invite your participants? How much time ahead do you want to give them? It's always a sensitive issue. We want to avoid stirring up anxiety, and yet we do want our participants to also feel prepared in some way for an important discussion regarding your wishes. What will you say as the reason for having this conversation? And if you can work out something simple and direct, that will be helpful to you both. Why is it important for you? And that's something that you can talk about using iMessages. We talk about using iMessages, sentences beginning with I. I would like to talk to you about something very important to me. This is something that I am asking for. And keep an open heart. This is a common denominator really for most communication, especially for something that is sensitive. Make sure that you are responsive and not reactive. The difference is when we react, we're impulsive. It's a knee-jerk reaction. When we're responsive, we take a beat. We take a breath. And it brings us to our center, and it helps us in our communication to our participant, and it also helps them be centered and focused on what this important issue is.
That's awesome. That's really good information. Grace?
Add something?
You betcha.
So in terms of setting the stage, I would also say that, so sometimes our adult children don't want to have that conversation. Mm-hmm. Denial is a wonderful place to live, or having a conversation about, future care, future living situations, all that can prompt them to it can stimulate like, oh my gosh, mom and dad are mortal. They're getting old, and many adult children don't want to think about that, and they may say, "Oh, don't worry, we don't have to talk about that." So it's important to state the importance and the value it is to you, like you said, right? So talk about your feelings and why this having a conversation is important to you. What is the value in that for you?
That's really, really important. And Grace, I would keep that mic ready and warmed up here, because I wanted to ask you, what would some of the conversational topics be that we here today would consider including when we get together with our loved ones? What should we be discussing? Perhaps. So give us some ideas.
Well, if we're talking about, the big, serious topics, then it might be advanced care planning, like I said, what are my wishes if and when I can't speak for myself? Where do I want to live in the future if I'm no longer able to live at home? When I need help, and let's be realistic, we are all going to need some form of assistance as we age. What sort of help do I want? Is it going to be a professional from one of the home care agencies? Is it going to be, my son or my youngest daughter or my stepchildren, or maybe it's a close friend, talking about all these things. Where do I want to spend my last days? Is it going to be in the hospital? Is it at home? What do am I going to, what's going to happen to my assets, right? The home, the family pets, all these things are really important. Who's going to manage medical care? Who's going to manage my finances? And I'll give you a tip. It should be the same person. It avoids a lot of family conflict.
No, that's all real good. And Ann, you had started us on this topic when you started also asking the question, what is equitable and sustainable? Should it be, do we look at maybe it's in a later question we have coming, like, who do we elect? Which kid, which child? Maybe, I don't know. Do you want to address any of that? What other conversational topics would we include in our talk with our adult children?
Yes, I'd like to expand on Grace's wonderful comments on this, electing our proxy, who is going to act on our behalf. It's such a sensitive topic. I actually know someone who in her trust documents wrote why she chose who she did. And it had to do with not loving one child less than any other. Sometimes it's not possible for that one individual to have full authority over healthcare and finance. And you can add another adult child or representative. I would caution you to place the second person as an alternate. So it's or, it's not and. So don't name Joey and Susie, but it's Joey or Susie. So that, and I'm sure working at Kaiser, you would know, if you have ands, then you have to have both of those adult children on the line to have that phone call. So it's very important that it is or, and an attorney will be able to help you do that, remind you of that, or if you are doing it yourself and you don't need an attorney to have a healthcare directive, you can get these at Office Depot, or you can just download them and print them out. They typically need to be witnessed, and they always need to be witnessed and notarized. There are so many topics that are important to share with your representative that you may not think about, and they're not thinking about, because you don't think about this until you're in that crisis moment. Where are the passwords, for instance, to your important information? Where is a safe deposit box? Where is the key for that safe deposit box? What bills are on auto payment? Which are not? Who are your taxes filed with? Where are the important papers? Who is the neighbor? Who's the closest neighbor who has a key to the house? Is there a spare key to the house? Do you want a spare key to the house in a lockbox, or do you want it hidden? And who knows where that is? It's an endless list that can keep us up at night. But these are important details to think about for your future, as Grace said, to act on your behalf in the event that you are unable to do so.
Grace.
Oh, and then I want to add on to what Ann is saying is, so most often we turn to our adult children for assistance. Now, some of us may not have reliable children. Some of us have chosen not to have children, and some adult children are maybe not emotionally capable of being there for us, right? So talk to people like us about community resources, because there's a lot of help out there besides your adult children that you can lean on. But we are most of us are not aware of what's out there, but we are, so you can talk to somebody like us to find out what's available for you.
So that's a really good point I want to bring up. We always send out an email after each seminar, and we say, thank you so much for coming. And then we will list all of their contact information and names and who they are with. And if you want to include any of those resources, like on a document that we could add, we'd be happy to do that. PDF or something. So we'll try to get to that information if we can pull that together. So Margot, the real question is, how do I really talk with my kids? I mean, I don't really want to have this conversation, really. Do I have to?
So I think, I work with a lot of families, and what I've really come to realize is that for many people, their children leave home about 18, they go in the military, they go to college, maybe they get married, and they live their own lives. And you see them a couple times a year, and they're not your closest people anymore. Your closest people is maybe your siblings, your neighbor. I know people who will tell me, my neighbor is my best friend. I'm closer to my neighbor than I am my daughter. So maybe that's a question to really think about. Who is making your decisions, and do they really know you? And I know it can be kind of controversial, but sometimes the best advocate are not those who you think they are. If you're really having those really hard conversations and you're not being able to make the next step forward, maybe your adult children aren't, or that child or whoever you thought wanted to make decisions isn't. And that could be the conversation. Because I think these are really, this is something you don't really want to get wrong, right? This is something and everybody has a story where everything went wrong, right? And then you have another story where everything went the way you want it to go. So I think it's just an expectation that even people trying to make their best decisions don't always make the best decisions for them. But think about that. Who is your team? We're getting ready for NFL, right? Super Bowl Sundays. Who's on their team? Why is that a winning team, right? Why? Well, who's your team? If you're sitting down to really make these decisions, who's on your team? And it's okay if it's your neighbor. It's okay if it's your best friend. Maybe it's okay that it's not, adult children are just adults, right? They may have made bad decisions, and you've seen them maybe make decisions you didn't like with their in-laws. Right? Everybody knows these stories. So think about, who do you want on your team, right? Who is it who you want there? So I think that is an important question to say. And then say what you want. And if they don't like what you say, if they really can't get beyond that, again, who's on your team? And when I say on your team, I want you to think I want you to think about, are you a Mason? Are you part of a church, a religious organization? Are you part of the Rotary? That could be part of your team, okay? I know a number of people who are Masons, and that's like their family. Think about your community. And then respect that relationship. If somebody tells you that they can't come to help you, listen to what they have to say, and don't expect for them to do that. And then respect what you need yourself. If you're not, figure out what you need, where you can compromise, and also where you can't compromise.
And obviously, I think before you have this talk, you're going to want to have taken some time, and we did start out by saying this, take some time to be thinking about what you want, and you may need to take some time to do some research. Have a discussion with your partner, if you have a partner, a spouse, and make some decisions on your own before you bring it up with your kids. I will say, as an adult child of a much older parent, this is a gift that you're going to be giving not only to yourself, but to them. Because there's nothing worse as an adult child than to have to guess what your mom or dad wants. Because we don't want to get it wrong. Because in my case, I adore my mom. And I want to make sure that I'm doing what she would want me to do. And she is one of these feisty moms that never wanted to have these talks. Whenever I bring up something, I get the, oh, well, let's not talk about that right now. I don't want to talk about that right now. I'm like, well, Mom, when are we going to talk about these things? So that's hard, but if we had had some of these conversations earlier, that would have given me peace of mind. So I'm just kind of telling you from another angle. And just as we coach our adult children that are supporting older parents as to how to start bringing up these conversations, you start by planting seeds. It's hard when somebody just, for the first time, just unloads a lifetime of things that they've been preparing for the last 35, 45 years. But sometimes it's just, start setting a seed. Or, well, gosh, Mom, your dad and I have been thinking, or we went and looked at this place, or, we've been thinking about doing some pre-planning for end of life, or whatever it is that you want to talk about. Those are just a couple of my 2 cents, being a lay person over here, not a professional like these women are. Okay, Judy. So we said that having these talks over Thanksgiving dinner in front of everybody probably isn't the best time to bring things up. But when would the best time be? And then, how do we kind of keep this conversation going? We meet, when is the best time? And then when would we meet again? How do we kind of keep it going so we have a plan?
Well, I'm going to answer this really quickly, and that is, this is called planning. So you want to send an email, a telephone conversation, however you want to do this, but say, this is a time where we're all going to sit down and I want to tell you what my wishes are, or we want to tell you what our wishes are, and we want your input on this. And again, we don't want it to be at Thanksgiving. We don't want when the toddlers are running around, interrupting all the time. So sometimes it's having a third party there. It could be your financial advisor. It could be your realtor. It could, if you want to be talking about, your assets in your home. But that person, it keeps things at a balance, and it also keeps things so people don't get too emotional. I am very big on teaching my clients how to set boundaries with their adult children, with each other, because as you know, these kind of conversations can go out of bounds really quickly. So you want to learn how to do that when you have these conversations.
Anybody want to add to that? Because there's a lot to unpack there.
I want to add something.
Go ahead,
I
Margo.
also think that when you have a difficult conversations, I like to set time frames. I want to talk about this for a half hour. Then I want to take a break. Because I find that they're stressful, they're difficult. It's, again, having that you're talking for a half hour. So if people are having a hard time, it's a half hour talk. And then maybe you say, okay, we can only talk about these things. And then you agree to reschedule. Everything doesn't have to be addressed or solved in that one conversation. And sometimes you're surprised by how quickly it goes. But that would be my suggestion.
That's really good. Grace?
I would say that even in that half hour, if people are getting activated or upset, that it's okay to stop and call it out. Like, hey, I feel myself getting upset, or I see that you're, crossing your arms and frowning. So are you frustrated or are you angry? And if they say, well, yes, or, then you say, well, how about we take a break and come back when we're all calmer?
Yeah, that's really good. Really good. Okay, Anne, we're talking about how to do this right, but what are some impediments of effective communication that we should be aware of?
Yes, well, the ineffective communication is something like when the sender lacks clarity concerning the message, something vague that's not going to be helpful. If the sender lacks confidence in what they are communicating, that's not going to get the attention that you want to elicit. Failure to encode the message effectively, that would confuse a participant. So that's why we're talking about how important it is to plan ahead and have clarity. Excessive noise or interference. Good to have a conversation in a quiet place with few distractions. When the recipient is unable to process the message satisfactorily, that's certainly a huge impediment to good communication. And when the sender fails to integrate feedback into future communication. So let's think about what effective communication looks like. I suggest you try to cover the most pressing concern at the beginning of your meeting, the thing that is most difficult to talk about. And we're all acknowledging that we know people in our realm who don't want to have the discussion. And that's valid. And your response might sound something like, I know this is hard to talk about, and I hope it doesn't have to take place. I hope what we're talking about would never have to be implemented. And if it does, not for a long, long time. I used to always say that to my mother. She'd say, well, I'm going to die soon, but I hope that doesn't happen for a very long time. So acknowledging those reluctant responses, it will help your participant feel that they are being heard. The meeting should not last more than an hour and a half total. And as my colleague is stating, maybe a half hour at a time. That might be just enough of a bite size to get something going that's approachable. I also wanted to mention the time for you to have this is when you are well rested. So make sure you've done your self-care for the days before this important conversation, which is you're going to be ruminating about, thinking about, and maybe you want to talk to an objective professional about, as Grace is mentioning, someone who doesn't have skin in the game or a stake in the outcome, someone who you can speak freely about and who will have maybe a wider view of a situation. We all have our blind spots. Maybe it's someone you trust who knows you well enough to know what you may be neglecting to prepare for or think about. And make sure that you are well nourished and well hydrated in addition to being well rested. So you feel good and you can have that confidence and clarity of mind. Also, ask your recipient what they have heard you say. That is a helpful technique. It can seem to be condescending, so the way you say it is very important. So it might sound something like, I've just said something to you that is important to me, and I want to be sure that you have heard me in the way I intend. Tell me what you heard. Tell me what you heard me say. And then it's your opportunity to listen carefully, and if what you are hearing fed back to you is nuanced in a way, going in a direction that you hadn't intended, this is your opportunity to say, that's not quite right. This is what I have intended. For instance, if you're talking about your healthcare wishes specifically, I want you to know what my healthcare wishes are because I trust you. And I want you to know that I don't want to have tube feeding. I don't want intubations. If I am unable to have a quality of life that is meaningful to me, I would like to have a natural death. What did you just hear me say? This is a hard conversation to have with someone who loves you and who you love. And it's an important one if you truly want your healthcare wishes known, especially if you want a modified code of medical support in the event you're not able to speak for yourself. But there are certainly other situations too. So You can decide if you want to wait until any final decisions are made when you have this conversation. And you can say that at the beginning of your conversation. Let's decide we are not going to make any firm decisions today. Let's use this time so that I can tell you what I want to say, and then I want to hear your response, and then I want to sleep on it. I want to think about it. I want to digest it and process it, and then I want to get back to you about what I've decided.
That last point is huge. I was taking copious notes there. To ask the person to tell you what you've just said and how they interpreted it, mind-blowing. I mean, obviously a natural thing for you, but that's very, very, very important, and something I'm going to start incorporating actually even in my real estate practice, right? Because, yeah, wow, that's wonderful. Anybody want to add to any of that? The impediments or effective communication?
I'll just add that